Okay. Good afternoon, everyone. Good morning, maybe for some of you guys. Welcome to It's Worth a Shot. Today, we are going to be talking about security risk analysis, and we are going to have a presentation on the Center of Excellence. So let's go ahead and go to the next slide. I just have a couple of updates and reminders for you guys. Officially, as of yesterday, August is National Immunization Awareness Month. So happy National Immunization Awareness to everyone. Just wanted to give you guys a couple of updates and reminders. If you are not subscribed, I would recommend you guys get subscribed to the Health Alert Network. They have some really great information here. I just put one of the recent HONs that they sent out. One is about wildfire smoke. Also on the morbidity and mortality weekly report, that is another one that you guys can get signed up for. So you guys get those updates as they come. And then the other one is about outbreaks, sorry. And that's another one you can subscribe for updates on the Food and Drug Administration's site. So if you guys are curious about getting those updates, I would highly recommend that. Let's go ahead and go to the next slide. One of the recent outbreaks is has to do with the sliced strawberries. This is one that they sent out. So just to give you guys an example of some of the information that they send out, and again, this is just really good information to have. This one actually impacts one of our regional states of Hawaii. So again, just encouraging you guys to get on there and take a look at those and get signed up. So let's go ahead and go to the next slide. So just a reminder that if there's topics that you guys want or any ideas or needs, make sure you guys plug those into the chat, and then we will also be sending out the evaluation. So make sure you guys fill that out. We take a look at those and get some really great feedback and suggestions from you guys for upcoming training. And then we will go ahead and do a quick polling question. Okay, are you currently using or anticipate using mobile vaccine clinics? Okay, it looks like some of you guys are going to. Let's go ahead and we'll end that poll. Looks like about half of you guys answered. If you guys need assistance with mobile vaccine clinics or are interested in that, reach out to your account manager and we can help get you guys set up with that or answer any questions that you guys may have. Let's go ahead and go to the next slide. Okay. For the next slide, you guys will see that our trend line, unfortunately, has taken a turn in the wrong direction. There's been a 12.1% increase in the most recent week with over 8,000 hospitalizations. Luckily, our deaths is not trending that way, and vaccinations are not making a huge increase there. Let's go ahead and go to the next slide. And this one, you guys will notice that our map looks different this week. We wanted to show you guys a different map this week. This one shows the percent increase in cases. That way it gives you a better idea of where we're trending and how you can see where hospitalizations are going up. And this is also by county. So you guys can see if you go to the map on the link there, you can hover over the counties and it will show you the percent increase in those areas. Now you'll notice the substantial increase is in the orange color. So we do have some of those hot spots in our region in Montana and Hawaii are experiencing some of those. You guys will see there was 12% increase in just the past week, like I mentioned. And unfortunately, we do have that steep curve. So it kind of looks like there's an uptick in cases. I know I'm here in Wyoming and we've had some here locally. So it's kind of strange to walk around the community and see people in masks again. So let's go ahead and go to the next slide. And I'm going to turn the time over to Allison Bishop. She's one of our account managers for Mountain Pacific, and she's going to talk to you guys about security risk analysis.
Thanks, Callie, and hello, everyone. As Callie said, my name is Allison Bishop. I am an account manager with Mountain Pacific in Montana. I provide assistance and guidance on security risk analysis along with HIPAA compliance. Next slide. So SRA stands for Security Risk Analysis, and they can be helpful for a facility to identify, assess, and assist with implementing key security controls to protect the facility's patient information. And SRA also can help you understand where your PHI could be at risk based on the policies and procedures that are currently put in place at your facility. Next slide. It's important for any facility who stores and manages patient information to complete an SRA on an annual basis. That means nursing homes, clinics, hospitals, and any business associate who stores PHI on behalf of their clients. An SRA looks at the different policies and procedures that are put in place or not put in place and identifies the amount of risks the facility has where PHI is involved. It also helps clients or facilities comply with CMS requirements, whether it's for CMS certification or if they're reporting to the CMS quality payment program. If your facility is a nursing home, the requirement for that for an SRA falls under the tag F836. An SRA is also required by the Office of Civil Rights, or OCR, to ensure that the facility is compliant with HIPAA security and privacy rules. For specifics on that, you can look at CFR number 164-308A12A, or we will provide the link on the resource slide for this section. The other piece of that is that if a facility has completed routine SRAs and they are subjected to a breach, OCR will take that into consideration and notice their SRAs and see that they're doing their piece on preventing breaches and protecting their PHI, meaning that their fines most likely are to be lower than if the facility doesn't have any SRA completed. Next slide, please. Another important reason to complete an SRA is that it plays defense against a breach happening. And with today's world and the advancements of technology, more and more breaches are happening. And if you are subjected to a breach, there's some things that might result from that. You might need to consider hiring lawyers to help you get you through all the legal aspects of a breach. And that could be very expensive and time-consuming process. And in the end, if it were ransomware and they grabbed your data, there's really no guarantee that you're going to get that data back. If you have a breach and you're subjected to financial penalties from OCR, those penalties can range from $100 to $50,000 per violation. Meaning if you have a breach and it was the result of multiple violations, you would get a fine for each violation they find. And as I stated on the previous slide, if you have an annual SRA, you can prove you're doing your due diligence to protect your patient information. And it is said that they do take that into consideration, and most likely the fines will be lower than if you didn't have an SRA. The next thing is that our patients put their trust in us and confidence in us to protect their information in order to help them get better. So if a breach were to happen, that trust that the patients have in that facility could be lessened, meaning the reputation of the facility is seen as less than it was prior to the breach. And lastly, some breaches might cause some everyday operations to be put on hold as well, as they've locked you out of your system and won't give you access until you either pay the ransom or figure a way around it. And then ransomware can also be seen as a consequence of a breach. And with ransomware comes many other decisions to make in order to get your data back or back to regular operations. And the biggest of that is to decide whether or not you're going to pay the ransom. Next slide, please. So that's my quick rundown on why it's important for healthcare facilities to complete an SRA. If you have any questions about completing SRAs, please don't hesitate to reach out. I will answer to the best of my ability. And next slide, please. And then, as I stated before, these are some resources that might be helpful. So there's the HHS guidance on risk analysis, and then the HIPAA journal, what the penalties are for the HIPAA violation, just goes over the different tiers of violations.
All right. Thank you, Allison. We will go ahead and turn the time over now to Stephanie Smith. She is working with the Center of Excellence, and we're going to go ahead and let her present.
Thank you. So my name is Stephanie, and I'm the Region 8 Behavioral Health Specialist with the Center of Excellence for Behavioral Health and Nursing Facilities. Today, I'll be giving you an overview of the Center of Excellence, how we were established, our purpose and goals, the services we offer, eligibility, and how those services can be accessed. And a little background about me, I'm a licensed clinical social worker, and I've been working in the field since 2008. And I've worked in multiple settings, including residential behavioral health, child welfare, the nonprofit sector, and medical social work. I would like to thank Mountain Pacific for the opportunity to allow me to speak here today. Next slide. Our Center of Excellence was established through a collaboration between CMS and SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration, and they are the federal agency that focuses on meeting behavioral health needs of Americans. They awarded and administered this grant. Alliant Health Solutions is the primary awardee, and they have subcontracted to Commagin to serve the western part of the US, and I work on the Commagin side. The Center of Excellence is currently funded for a 3-year period, which started in September 2022 and will continue through September 2025. Next slide. Our Center of Excellence is not the only Center of Excellence that SAMHSA has sponsored. The Center of Excellence is a model that SAMHSA developed to provide targeted behavioral health resources and supports to special populations. There are over 15 different SAMHSA Center of Excellences, and they all focus on different populations and settings. Our Center of Excellence is focused on behavioral health and substance use in nursing facilities specifically. Next slide. The purpose of the COE is to serve as a centralized hub for expanding capacity in CMS certified nursing facilities and caring for residents with behavioral health and substance use conditions through training, technical assistance, resources, and workforce development. The COE is specifically focused on 4 areas. The first being serious mental illness, such as schizophrenia, bipolar, or major depression. The second is serious emotional disturbance, which are conditions that affect the pediatric nursing facility population. The third is substance use disorders, including alcohol, opioids, or other addiction disorders. And the fourth and final area is co-occurring disorders, which is when a person has both mental illness and substance use disorder. They're often linked and benefit from being treated together. These 4 behavioral health focus areas are impacted by the CMS nursing facility regulations, including the phase 3 rules of participation that became effective in October 2022. These regulations had significant guidance for nursing facilities around meeting the behavioral health needs of their residents. Our center incorporates the CMS regulatory guidance into the behavioral health trainings, resources, and technical assistance that we provide to facilities. It's worth noting that the center is not focused on dementia and is primarily focused on behavioral health needs in nursing facilities. Next slide. The Center of Excellence is a national initiative and is tasked with supporting nursing facilities across the United States and its territories. The Center of Excellence has taken the approach of providing a regional behavior specialist in each of the 10 regions designated by the Department of Health and Human Services. Each of our behavioral health specialists live in the region that they serve, allowing them to be knowledgeable about the local and regional issues, which what kind of behavioral health resources are available, and state regulations and trends. Additionally, we have a recovery specialist, training and education lead, and many subject matter experts on behavioral health in nursing facilities that we use to develop our trainings and resources. Next slide. And again, I'm Stephanie. I'm your Region 8 behavior specialist, and I'm located in Denver, Colorado. When requests for trainings, resources, or technical assistance are submitted, I'm the primary contact who will respond and work with those facilities. Next slide. Next, I'd like to talk about the audience, the Center of Excellence. I want to highlight that the majority of our trainings are aimed at all levels of nursing facility staff, including administration, directors, social services, nurses, CNAs, as well as housekeeping and dietary staff. This is aligned with best practices by providing behavioral health knowledge and skills to all staff in a facility. We are helping facilities align with the CMS guidance on behavioral health education and addressing the skills and knowledge of all staff who interact with residents throughout the day. Next slide. To start, we offer what we call foundational trainings. These are trainings that we make easily accessible by offering them monthly and allowing facilities to register and attend. Some of these trainings can accommodate large groups, so facilities can have all their staff register and attend if they would like. Some examples of foundational trainings include our Mental Health 101, Substance Use Disorder 101, and Trauma-Informed Care. Some of these trainings provide certifications, such as the CARE Serious Mental Illness, Mental Health First Aid, CPI Verbal De-escalation, or QPR, which is a suicide prevention training. Typically, these types of trainings have a cost for staff per certificate, but the Center of Excellence covers all costs for nursing facility staff through our grant. Nursing facility staff can view upcoming foundational trainings by going to nursinghomebehavioralhealth.org or contacting their regional behavior specialist. Next slide. In addition to providing live virtual trainings, our center also develops on-demand trainings and behavioral health resources specifically designed for facilities. Our on-demand learning resources provide an opportunity for individual facility staff to get training at the most convenient time for them. Additionally, resources including tip sheets, flyers, pamphlets can also be utilized by facility and staff to increase their knowledge and skills. And while trainings are for CMS certified nursing facilities, some of our past foundational trainings and other resources are available to view or download online by anybody who accesses the website. Next slide. The center also provides customized training and technical assistance to nursing facilities. That means that our behavioral health specialists talk with facilities to understand their unique resident population and facility behavioral health capabilities. And then together with the facility, they identify training opportunities and resources to meet their needs. Next slide. Another kind of training that we'll be offering later on this year is the cohort learning series, which is led by the Imagine team. And this will be an opportunity for nursing facilities to join a group of other nursing facilities in a monthly learning. They'll have behavioral health learning opportunities, and there will be a piece of like education and group share and learn from each other. Next slide. As for eligibility for services, all of the Center of Excellence services are for nursing facilities that are CMS certified. If a facility is listed on the Medicare Care and Compare database as a nursing facility or skilled nursing facility, then they're eligible for services. And while non-certified facilities are not eligible for the training or for the online trainings or one-on-one technical assistance, they are still able to access the resource hub, which has plenty of different support and resources. Next slide. So when to request help from the COE, we suggest reaching out to the center when a facility has identified a specific gap in staff knowledge or skills in meeting behavioral health needs of residents at their facility. Nursing facilities can also request help if they're having difficulty meeting a particular resident's needs and would like some technical assistance. And really, facilities, if they don't really know where to start in regards to behavioral health training and resources, we can work with them to evaluate, prioritize, and make plans for trainings and resources. One important thing about the Center of Excellence for Behavioral Health and Nursing Facilities is that we are not an emergency service. So if a facility is experiencing a behavioral health emergency, they should immediately call 911 or talk to an attending physician for guidance. After the emergency has resolved, the center is there to provide training and technical assistance and support to the staff. Next slide. The center takes a no wrong door approach to submitting a request or asking for help. The first way is to submit an inquiry for assistance on the website, which is nursinghomebehavioralhealth.org. The second way is that it can be submitted through a call center, which is staffed Monday through Friday from 1 p.m. to 5 p.m. Eastern time. And the last way is that facilities can reach out to me directly via email or phone. If they don't want to go through the process online, they can just contact me directly. Next slide. And as we come to a close, here are a few ways to stay connected with our Center of Excellence and get updates about our latest news. Our monthly newsletter is the best way to stay connected. The newsletter highlights new behavioral health resources, upcoming trainings, and any behavioral health regulatory updates. And you can sign up for the newsletter at nursinghomebehavioralhealth.org or by scanning this QR code. We also have active social media profiles on LinkedIn, Facebook, YouTube, and Twitter. Just search Center of Excellence for Behavioral Health and Nursing Facilities. And if you'd like, we also have a text messaging platform to send out information that way. Next slide. And on behalf of the Center of Excellence team, thank you for listening to our presentation today. And we look forward to working with all of you. Feel free to reach out at any time. And then next slide. And that's it for me.
Okay, thank you, Stephanie. I did go ahead and plug in your website into the chat so you guys can take a look at that. And let's see if there's any questions in the chat for today.
There's also a flyer provided by Stephanie that has registrations for upcoming educational meetings. I think there was one on Friday, but it looks like the registration for that is already closed. So we will send that flyer out to the register or the participants today. So that way you could just click the links to register.
Yes. Mary, can you turn the slides back a couple so we can go to the QR? There you go. Okay, thank you for that. And we did have a question, Stephanie, about contact names for Alaska and Hawaii providers. If you happen to have those contacts.
I do. Let me find, so David is Alaska and Tara is Hawaii. So I will, should I pop them into the chat here or should I send it to you guys separately?
Go ahead and put it in the chat and then also send it to us and we can put it, actually, if you could send us for all of our states, which is Montana, Wyoming, Alaska, and Hawaii, we'll put them in the FAQ document for next week as well.
Oh, perfect. I'm also Wyoming. So,
okay.
And I will get David and Tara's info in here.
Thank you. Do we have any questions for Allison or Stephanie?
Okay. Just as a reminder, don't forget to click on the link to complete the evaluation. Again, your feedback is appreciated. And I went ahead and dropped all of the links from the updates that I referred to. So if you guys take a look at the chat, and we will also put those out with the resources that we send out as well. So, and then Stephanie is plugging in the Alaska contact. So if you guys want to stay on for just a minute, you guys can grab those contacts out of the chat.
And next week's It's Worth a Shot, we're going to be covering NHSN updates with Lori from Mountain Pacific. I know that there's been some outages and some questions recently, so she's going to come on and help answer those and give some updates. And then I believe we're going to go over the QSO-23-02 all memo that came out, and then potentially IP guide that Mountain Pacific has put together. So next week, we will be talking about NHSN mostly.
Okay. Well, thank you again, Stephanie and Allison, for presenting today. We appreciate you guys, and we will see you guys all next week. Have a good day.